This video will begin with the head and anterior neck muscles, beginning with the frontalis, highlighted here. The frontalis is going to originate on the galea aponeurotica. It wraps around to the entire portion of the top of the head, and the galea aponeurotica basically means helmet, so top of the head and helmet. Its insertion point will be on the skin of the eyebrows, just above the orbit, and its action is actually to raise the eyebrows. So its insertion is on the skin of the eyebrows because its action is to raise said eyebrows. Next we have the orbicularis oculi. The orbicularis oculi is orb-like, and oculi, kind of like the oculus, which Meta came out with, has to do with the eyes. So orb-like eyes, muscles. It's going to be originated on the frontal bone and the maxillary bone. As seen here, the top portion is on the frontal bone, while the bottom portion is originating on the maxillary bone. Its insertion point will be the center eyelid. Its job is to both close the eyes and squint the eyes. So basically everything that has to do with the eyelid is going to be controlled by the orbicularis oculi. Next we have the risorius muscle. The risorius muscle is going to be originating on the fascia of the cheek, and its insertion point will be the corner of the mouth. Its action is to move the corner of the mouth laterally. So when we smile, this will move the corner of our mouth towards our ears. After which we have the zygomaticus. The zygomaticus is going to be the muscle which elevates the corners of our mouth when smiling. Its origination point is going to be on the zygomatic bone, very near the zygomatic arch. As seen here, its insertion point is going to be on the corner of the mouth. Zygomaticus is easy to remember as the zygomatic muscle which connects to the cheek, zygomatic bone, as well as inserting onto the corner of the mouth because its action is to elevate the mouth. Next we have the masseter. The masseter is going to originate on the zygomatic arch, not just the zygomatic bone, but on the actual arch, as well as insert onto the ramus, as seen here, the ramus of the mandible. Its action will be to elevate the mandible / close the jaw. So by elevating the jaw, closing the jaw, we are going to bring the teeth towards the top teeth, thereby elevating the mandible. Once again, originating on the zygomatic arch, inserting on the ramus of the mandible, and it elevates the mandible. After this, we have the temporalis. The temporalis muscle is going to originate on both the temporal and parietal bones. Its insertion is going to be on the coronoid process of the mandible. As seen here, it is originating on both the temporal, which is completely covered, and parietal bones, and the insertion point, if we can find it, is going to be on the coronoid process of the mandible. Here we go, as seen here. This is the coronoid process of the mandible. Its job is to also elevate the mandible, thereby closing the jaw. Now we will move on to the muscles of the anterior neck, starting with the digastric muscle. The digastric muscle is going to originate on the mastoid process of the temporal bone and insert onto the mandible. So highlighted here, we have the insertion point. This is where the mandible is going to be connected to the digastric muscle. It is also connected to this muscle via the hyoid bone, as seen on this lower portion. The digastric muscle is kind of a curved muscle which goes from the mastoid process of the temporal bone towards the hyoid and then turns upwards towards the mandible. So it gets to the insertion point, the mandible, via the hyoid bone. Its action is to depress the mandible / open the jaw and elevates the hyoid bone during swallowing. So it opens the jaw during mastication and then elevates the hyoid bone during swallowing. After which we have the mylohyoid bone muscle, which is going to be originating on the mandible, and it inserts on the hyoid bone. The midline, which would be the white line visualized in the center, is going to be where the two muscles meet, and its action is to elevate the floor of the mouth, thereby pushing the tongue towards your palate. Mylohyoid, it originates on the mandible, and hyoid would indicate that it inserts onto the hyoid bone. Once again, this includes a midline where the two muscles meet, indicated by this white line in the middle. After the mylohyoid, we will move on to the sternohyoid. The sternohyoid muscle is going to originate on the manubrium of the sternum, and it inserts onto the hyoid bone. Its action is to depress the hyoid bone. So originating on the sternum and then inserting onto the hyoid bone, sternohyoid from the sternum to the hyoid. Its action is to depress the hyoid bone. Thereby, whenever we finish swallowing, it depresses in order to get back into its relaxed state or its normal state. After, we have the mastoid. This is going to originate on the manubrium of the sternum as well as the clavicle. Its insertion is the mastoid process of the temporal bone, and its action is to both flex the neck and rotate the neck. This is going to do so by originating on the manubrium of the sternum, sterno, and the clavicle, clitoid, and then inserting onto the mastoid process of the temporal bone, mastoid, sternocleidomastoid. Action is to flex and rotate the neck.